Morning, I'm Lacey Nobles with the City of Lubbock. Our news conference will start in just a few seconds. Hi, and welcome to the City of Lubbock COVID-19 news conference. Today's panelists are Director of Public Health, Catherine Wells, Public Health Authority, Dr. Ron Cook, District 1 City Council Member Juan Chidas, District 2 City Council Member Sheila Patterson Harris, and Lubbock Mayor Dan Pope. And we have two very special guests with us today, former City Council Member Maggie Trejo and Community Leader Vernita Woods Holmes. And we will hear from them in just a minute, but let's get started with Catherine Wells.
Good morning, everyone. It's great to be back here today. Just quickly want to go over our numbers from the last week. Our cases are still high, but we are continuing to see kind of more of a steady number of cases, averaging around 200 cases a week. And that's very different than what we were talking about back in November and December. I really hope that we can keep these case numbers low to kind of keep the number of new COVID cases in our community much less. We're also seeing our hospital rates trending down, which is also a good sign. But even with this, we need to pay attention to those public health measures that we've been talking about for the last 9 months. Make sure you're wearing your mask, practice that social distancing, and wash your hands. Now on to some really good news. We're really excited that the City of Lubbock Health Department, or the city, was selected as one of our regional sites across the state of Texas for mass vaccines. Our goal this week is to deliver 5,000 vaccines to individuals in Lubbock and our surrounding areas. This will be the largest number of vaccines that we've delivered in 1 week, and we're really excited and confident that we can get this done. These clinics are operating at the Civic Center, and it is a combined effort of the City of Lubbock Health Department, our Lubbock and Fire Rescue, city staff from other departments such as Civic Center, Parks and Rec, Codes, Lubbock Police Department, and we've also gotten some support from the Lubbock Sheriff's Office with providing security. We are also utilizing many volunteer groups. Today we're operating the clinic. We have over 40 volunteers there today, students from Texas Tech, volunteers from local churches, and we really appreciate all of that assistance. This can't be done just with the health department alone. We have not received notification of our vaccine allocation for next week. I'm hoping that it will be around that 5,000 mark, but we will not know probably until later this afternoon, possibly tomorrow. And once we know that allocation, we'll be making plans for vaccine and then be opening up additional appointments. We're getting lots of questions about second doses at that vaccine clinic. Those people can come through that clinic for their second doses starting the week of January 25th, and we will be announcing those clinic plans shortly. Remember that with the Moderna vaccine, that's the vaccine we're providing at the Civic Center, it is a 4-week or 28-day time period between when you get your first dose until you need that second dose. So we just want people to know that those clinics are being planned, and we will make those announcements shortly. Again, we're excited to be offering the vaccine clinic at the Civic Center. And with that, I'll pass it over to Dr. Cook.
Thank you, Catherine. Let me just reiterate that we're truly excited about this huge vaccination clinic that we're getting. And we've been reassured that we will get vaccine. We just haven't heard for more vaccine to come in the following weeks. But we're truly excited about being a vaccine hub, as Governor Abbott described the other day on his press conference. On the clinical side, our hospitals still remain full. Our ICUs are full. Last night we had 1 bed available that was open for admission to people. So we're not out of the woods yet, but I agree with Catherine. Our numbers are plateaued, maybe falling a little bit. Just a few weeks ago, our ICU beds, we had about 90 patients in the ICUs. Now we're down in the 60s. That's good news, but our ICUs are full still. That just means sickness is still present in our community, and those individuals that need to be in the ICU are now have better access to our ICUs, but we're still full. That just goes to show that we must continue our mitigation efforts to stop the virus and stop the spread of the virus. We've already lost more than 600 family members and friends to this disease, and we must continue to respect this disease and this virus and how lethal that it can be. As Catherine mentioned, it's good news that our vaccinations are going very well. We're still in phase 1A and phase 1B, which are frontline workers and those that are 65 and older, or individuals from 16 and above that have significant morbidity or significant diseases that would cause their immune system to be suppressed, or they wouldn't do well if they were to get this virus. Please know that this vaccine is safe. I know of just a few allergic responses, and I know of nobody that had to be put on a ventilator after this vaccine. Well, you hear a few of those case reports across the nation and across the world. I know of none of those incidents happening here in Lubbock. I know of a few people that had some rashes and a few people that may have required epinephrine. But that's pretty rare. Remember last time I said that's about 11 people per million doses given. So that's pretty rare. If you do require epinephrine, or if you had an immediate reaction after the injection, you need to talk to your primary care physician about getting the second dose. Right now, that's not recommended, but I would encourage you to talk to your primary care provider about should you take that second dose. And as Catherine said, also, you need to get both doses if you're eligible. You don't have one of those previous reactions I talked about. To get our antibody level at its highest possibility for protection from this virus, you must get that second dose. And as she said, it's 4 weeks out. So do your best. You'll be notified. Pay attention to that date that's on your card that you received that talks about when you should get that next vaccination. It is a very safe virus. We must get to about 80% of herd immunity before we can get away from our masks and our social distancing. So we've got to get there. It's going to be my prediction is probably around late summer before we actually get there. And that's if we encourage everybody to get the vaccine. Other good news, there are more than 60 other vaccines that are in the work. The one that's in the forefront and it's already been approved in the United Kingdom is called Astrazeneca. It's about 70% effective according to their studies. However, it is significantly cheaper to produce and to administer than the current Moderna and Pfizer vaccines. So that's good news. I think it'll be here soon in the United States, just to have more access to vaccine. And again, there's about 60 other companies working on vaccines to help stop this deadly virus. You may have also heard about this more infectious mutation in the virus it's even here in Texas. It does not look like it causes more severe disease. What it does do is it's much more infectious, so it spreads more rapidly. And that has some concerns to the healthcare workers because that means at any given moment, more people can get infected from the virus and subsequently get sick from the virus and perhaps need hospitalizations. So that concerns us. All the more reason to make sure that we wear our mask and do our social distancing and washing our hands to help stop the spread of this virus. We also have a significant amount of those antibody drugs that we talked about before. That's the bamlanivimab and the Regeneron. And if you have had a positive test and you are high risk for bad outcome, in other words, do you have diabetes, uncontrolled hypertension? Do you have some immune disease? Do you have chronic kidney disease? And if you're positive, please talk to your primary care doctor about getting in and getting an infusion so we potentially keep you from being hospitalized from this drug. We have lots of those antibody drugs still available. Both Covenant and UMC have an infusion process for you to receive this drug. Remember, if you have any questions about the vaccine, its administration, its side effects, please talk to your primary care physician or your primary care provider about receiving and if you're eligible for this vaccine. In the meanwhile, we must continue to wear our masks. We must physically distance, but still be social. Stay in small groups and wash your hands. Let me introduce Councilman Chidas. He's next on our agenda. You guys have a blessed day.
Thank you, Dr. Cook. And good morning, everyone. Good information, Dr. Cook. My approach here will be a testimonial. The wife and I have both been vaccinated. Side effects, I experienced no side effects from the vaccination. The wife, she did experience some slight discomfort of her shoulder, but that was over and done with overnight. The next morning, she was doing just fine. Again, we personally experienced no side effects. I encourage everyone to go get vaccinated, and that is done by an appointment, making a reservation. And that number is 806-775-2933. And with that said, I'd like to say a few words in Spanish. Les recomiendo que vayan al centro cívico a vacunarse en contra de la coronavirus. Yo y la señora mía no tuvimos problemas, aparte de que ella sintió un poquito de dolor en el hombro, pero el siguiente día todo se le pasó. Por favor, vayan a vacunarse, es gratis, no les cuesta nada, pero tienen que hacer una cita primeramente. Y ese número es el 806-775-2933. El número otra vez es 806-775-2933. Y por favor, sigan usando la cubreboca, mantengan su distancia social y sigan lavándose las manos con frecuencia. With that said, I ask everyone to go and get vaccinated. It's absolutely free. The phone number again is 806-775-2933. Absolutely free. And continue wearing your mask. Maintain your social distance. And with that said, I'd like to introduce Ms. Maggie Trejo. I'll be signing off. Thank you.
¿Cómo están esta tarde? Voy a comenzar en inglés. So I'm here to ask you to go to the clinic next Sunday or next weekend for your vaccination of COVID-19. It is very important that you do so because all you hear in the news is about people getting sick, and not just mildly, but we've had a lot of deaths in our community. So I would urge you to go to the clinic, and they will be announcing where it's going to be at the Civic Center, but you'll get more information in a few minutes. So my thing here today is to urge you to go and get vaccinated. I took the shot, and I think I will go on the 28th of this month for my second one. And all I had was just a little soreness on my arm, nothing serious. Just in doing so, you go and because you want to protect your family, your friends, and anybody that is around you, especially the people that are 65 years and older. You really need to do this. Don't be afraid. Just make an appointment, and the number will be given to you in a few minutes. Entonces quiero decirles esto, que por favor, no dejen de tener esta oportunidad de ir al Civic Center y agarren su inyección. No tengan miedo, no es como 2 o 3 segundos que se lleva. El dolor muy poco, en el brazo, como 2 o 3 días. Solo que les pido que lo hagan no nomás para ustedes, pero para toda su familia, la comunidad, para que no haya tantos enfermos como lo está haciendo ahorita. Okay, honey. You said how many minutes?
Are you done or do you have?
Yeah.
Okay. And next up we have Ms. Holmes.
No, that was the Sheila.
Sheila Patterson. Sheila Patterson, okay.
Good morning, Lubbock, Texas, USA. I tell you, it is indeed a privilege to be here with you this morning, more than you actually know. You know, COVID has had an enormous impact on our city. And this morning, I can truly say I find myself on both sides of the topics that we're actually addressing here this morning, specifically having contracted COVID-19 in late fall. You know, I want to share with you that I actually have a 3-tier level of pain and discomfort that I have for myself as I experience things in life. And it's sad to say that COVID-19 has ranked up as position number 2. And because of the experience that I have with COVID, you know, I was kind of hesitant at first when first talk became of the vaccine. This is prior to my contracting COVID-19. But once I've had the experience that I did with it, I had no hesitation in signing up to receive the vaccine once my group was in place to begin to receive the vaccinations. I find myself with several medical conditions, which allows me to enter into group 1B, trying to keep up with those. But those same medical conditions that has allowed me to receive the first phase of the vaccine were also the conditions that made COVID-19's experience so difficult for me. That in the fact of being so fearful that I would somehow cause other family members to contract the COVID-19 virus because of the illness that I had. So as I stated, that it was not a hesitation once the vaccines became available. I have gone through the first portion of the process, receiving the Moderna vaccine, and will receive my second part of that vaccination soon. I have also had the privilege of being able to take my dad and have him become an individual that was also vaccinated, given his age and the medical conditions that he has. Contracting COVID and the fear of giving it to the family was enormous for me. And even being given the call that another family member had contracted COVID-19 just sent me over the roof. So I know from being on both sides how important it is for us to keep ourselves safe, masking up, keeping social distancing. And now that the vaccination is available to us, taking advantage of it as well. While it is definitely a choice for each individual, I would just encourage you, if you find yourself with particular medical conditions, age, working in the medical field and all of that, that you take advantage of the vaccine if you so choose. It is very important, not only just for yourself, but it can also help those around you whom you love and have so much contact with on a regular basis. So I just wanted to make sure I was here this morning to share this with you and kind of give my own side of this whole epidemic that we're experiencing. I have the pleasure at this time to pass the mic to a gorgeous lady who has been a huge influence over my life, as well as so many young people within the community, specifically in the district number 2, Miss Vanita Woods Home. And thank you for being here.
Thank you, Sheila, my pleasure. I did get the vaccine, and I must tell you that I was very concerned about getting it. But then I realized I was more concerned for if I didn't get it. So I went ahead and got the vaccine at the Civic Center, and everybody was very cordial, and I thought they did an excellent job of telling us what to expect and where to go and what have you. And one thing that impressed me as well is after I got the vaccine, we went into this room and we had to wait 15 minutes to make sure we were okay. And I was happy with that. I had no complications at all. I was not disappointed, but I was really looking at over in the night. I'd get up to make sure my arm was still there and wasn't swollen, and everything was just fine. I felt good about getting it, and I've told pretty much everybody I know that I've gotten it. Matter of fact, my son is getting it today. So I'm trying to protect not just myself, but my family and others. And I encourage others to go and get it. If I can do it, you can do it too. So now I'll just pass it on to Mayor Pope.
Good morning, everyone. What a treat to have both Maggie and Vernita with us today. Thanks for sharing, ladies, not only your vaccine story, but for what you've shared with this community for so long. We look up to you, and we're thankful for you guys. I'm going to start by sharing just a few data slides as become our practice. So if you'll allow me to do that. All right. So our hospitalization rate has settled in around the 20% rate. We certainly like to get that below 15%. That's the goal. But you can see our progress to that level, and we've hovered. We got below 20 for a couple of days. We've bounced back up above it. Remember, that's not just for Lubbock, that's for our trauma service area. New cases over the last 14 days. This looks remarkably like last week. If you look at the trends over the last, actually 2 weeks and 3 weeks, we're averaging about 250 new cases a day. Now, that's still too many, but the trend is very much going the right direction. And I believe that's because people are taking precautions to slow the spread, that we did Christmas differently and did it safely. So thank you for your efforts in that regard. Hospital beds, remaining beds, you can see that the slide here, we've had several good days in a row where we've had beds available for all patients at the end of the day. Remember that even though, as Dr. Cook talked about, even though our hospitals are in better shape from a COVID standpoint, this is the time of year that we really rely on our hospitals for other things. And so therefore, their census are increasing in other areas. Finally, today, a new slide. You'll see that through last Friday, we had vaccinated about 5,000 people in our city clinic. This is just City of Lubbock doses. And we'd only received 3,000 doses from the state. So that points out the partnership we have with our hospitals who shared extra doses with us. We did a few more than 1,400 doses yesterday. We will get all 5,000 of this week's allocation in people's arms by end of business tomorrow evening. So let me just pause and remind everyone, just building on some of the comments that we've had. We share our thoughts and prayers with families who've dealt with losses due to COVID-19, to those that are in hospitals today and fighting this, and to those businesses that have suffered and continue to suffer. And all of our efforts are towards getting our community healthy, both lives and livelihoods, and we'll continue to work that direction. We were very pleased that the state named us one of the 28 vaccination hubs. We feel like we're getting better every day at our mass vaccination clinic at the Civic Center. We're learning We think the sign up went very well this week with both Select a Seat and the phone. Select a Seat we seem to have worked what bugs there were out of it, and it is working very well. And we fully expect that we will run a clinic again next week. We don't have our supply number yet from the state. As soon as we know what that is, we'll let you know, and we'll let you know when you can sign up. We would expect that we will be doing this every week, that we will have supply, and we think that is very good news. We continue to work with our partners. We work with Texas Tech. We work with Covenant and UMC. We work with our school districts. They remain in very much in step with us. As an example, tomorrow we are going to vaccinate a number of Friendship ISD and Lubbock Cooper ISD employees that qualify under 1B at our clinic. We did the same thing last week for Lubbock ISD. We'll be working with Texas Tech to do the same kind of things for their qualified 1B population. Remember, the vast majority of these doses are guaranteed or not reserved for anybody, but we've pulled a few off to make sure that these folks that are interfacing with students can do so safely, and we think that's very important. We talked a little bit earlier about the second dose. So with Moderna, after 28 days, you need to get the booster, the second dose. That second dose is just the same as the first dose, same size, same actual medicine. You don't have to have it on the 28th day, but you need to have it in that period after 28 days, and that 2 or 3 week period after the 28 days. We will begin contacting you next week to set up appointments. If you scheduled via Select a Seat, you will get an email. If you came in, walk in, or via phone, we'll reach out to you in that manner to select appointments to schedule appointments beginning the week of the 25th. Now, not everybody will get theirs the 25th. Those that were vaccinated yesterday, your date will be 4 weeks out, but pay attention to the news on that. We will be communicating with you as to how that will happen, but your dose is secure. You don't have to go get in line and try to fight for that. Once you've had the first one, we can guarantee you that we'll have the second dose for you. The state received about 200,000 doses this week. We expect them to receive about 300,000 doses next week. That implies that we might get more next week. We certainly hope so. 2 more things I want to talk about. We've had questions about our senior centers, our senior adult long-term care. Those part of those beds that qualify as nursing homes are being taken care of by a federal program with Walgreens and CVS. And they're in the second group of facilities in Lubbock this week. They had 10 last week. They're, I think, doing a similar number this week. They'll have another group for next week. There appear to be a few of our senior centers that sort of fall in a gap, that won't be touched by the Walgreens and CVS program, but are going to need doses. And we're working to do some special kind of outreach clinics for those folks. More details to follow on that, but that's something that we're very much aware of. I think one final thing. We're working with other partners to stand up other vaccination clinics. We got word from the state last night that they like some of the ideas that we've sent them. So more to follow on that. We were very excited to see that United was able to set up a sort of a pop-up clinic at the supermarket on Parkway this week. We expect that they will be going to Amigos in North Lubbock next with a pop-up clinic. We're going to try to take these vaccines as close to the people as we can, but the best location will continue to be our mass clinic at the Civic Center. I talked late yesterday via text to a couple citizens. One of them said, I had my appointment scheduled yesterday. From the time I closed my car door till I reopened it was 23 minutes. If you'll show up on time for your appointment, there's no reason to get very, very early. Show up on time. We're going to move you through there efficiently and safely. We will continue to plan. We'll continue to improve what we're doing. We believe that planning is the antidote to panic. This is not about panic. It's about safely and effectively vaccinating our entire population. Lacey, back to you.
Thank you, Mayor, and thank you to our panelists. If y'all will all turn on your microphones and your cameras, we're going to open it up for media questions. And today our order is Texas Tech Public Media, the Lubbock Avalanche Journal, Fox 34, El Editor, KCBD, KMAC, KLBK, Latino Lubbock, and the Daily Toreador. So let's start with Sarah Self-Walbrick with Texas Tech Public Media.
Hello, everyone. Thank you to each of the panelists for being here today. My first question, there's a major hole in race and ethnicity data on the city's dashboard. Will that data be available eventually? And do we have at least anecdotal evidence of any communities that have been particularly affected by the virus?
Catherine, why don't you, we've been working on this a bit. Catherine, why don't you talk about this, please?
Sorry, I was still on mute there. The biggest challenge with the race ethnicity data is that it's with the electronic lab feeds. So when the data comes over to the health department, we don't have the race ethnicity data attached. So it's actually taking the contact tracer to make sure that they get that information in there. And that question doesn't always get asked during the contact tracing. So it is a challenge that we don't have that information. I think Lubbock's very similar to what we've seen nationally, that there is a disproportionate burden or a disease within both the African American and the Hispanic communities.
Sarah, were you talking about on vaccination or on cases?
On cases.
Okay, thank you. All right.
Okay, and then second question, Texas Tech students will return for some face-to-face classes next week. How could the return of thousands of students impact community spread? And do we expect to see that same surge we saw at the beginning of last semester?
Well, we certainly hope not. I'll start and I'll let Dr. Cook add to this. We certainly hope not. We saw it. We've learned from it. I think we've continued to get better. Tech, Lubbock Christian, South Plains College, they all remain very good partners, and we share the same goal, and that is a safe community and slowing the spread while we're able to effectively vaccinate our citizens. Dr. Cook?
Along those same lines, Texas Department of Emergency Management has agreed to return back to campus to do testing, and our overall city access to testing remains very high. So I know that in conversations with the administration at Texas Tech, where the Student Health Services has applied for vaccine, we have not received any at Student Health Services, but remember that most of those students fall in phase 3, low risk individuals, but we're ready, and all the mitigation efforts on the main campuses, cleaning and social distancing and all those sorts of things are still in place for this fall or spring semester.
Great, thank y'all.
Thanks, Sarah.
Thank you, Sarah. Now we have Matt Dotre with the Lubbock Avalanche Journal.
Good morning, everyone.
Good morning.
This is the first time hearing that Lubbock has been approved as a regional site for mass vaccines. Tell me, Ms. Wells, can you tell me a bit more about what that means? So I'm assuming Lubbock will get more doses, and does that also mean that it'll start opening up to neighboring counties and kind of it'll be encouraging people from nearby counties to come get vaccines in Lubbock as well?
Yeah, so on Sunday, the Texas Department of State Health Services announced the move to looking at opening up these very large vaccination sites. And in that release, the City of Lubbock Health Department was announced as one of those sites. And we don't know what those vaccine allocations are, but the idea or the goal is to have large quantities of vaccine come into that clinic regularly so it can be stood up multiple days a week, so that we can ensure that there's continued access to vaccine to our community. And part of that is letting that be a regional site and encouraging individuals from our surrounding counties to come into the Civic Center for that vaccine. And that's very similar to how we're a medical hub. Many people come here for their medical care. So we hope that the Civic Center will be a place that's accessible to them also to receive this vaccine.
Okay. Very good. And thank you. Ms. Wells, can you also talk a bit about, I guess, the logistics of the second dose? So I think Lubbock, there was about 2,000 vaccines given on the last week of December. So that means the week of the 25th, there should be about 2,000 people looking to get their second dose. So does that mean, assuming Lubbock gets 5,000 doses, does that mean 2,000 will be set aside for the second dose? Is the second dose given priority?
Actually, the second dose will be in a separate allocation to what we would receive for the mass distribution site. So we would receive the 5,000. If we were allocated 5,000 doses for that week, we would receive 5,000 plus an additional 2,000 to do the second dose. So we could potentially be running 7,000 or 8,000 individuals through the Civic Center a week.
Okay. Okay, very good. Thank you.
Thank you, Matt. Now we have Tori McGee for Fox 34.
Good morning, everyone. As it's been mentioned, we've been continually seeing a steady number of cases over the past few weeks. They've kind of plateaued. I guess my question is, what could that be attributed to? And is it too early to know if vaccines are playing a part in that?
I'm sorry, repeat your question, Tori.
So we've been continually seeing a steady number of cases over the past few weeks. And my question was, what exactly could that be attributed to? And is it too early to know if vaccines are playing a part in this?
It's probably a bit early. And so we just have to watch and see what happens.
I'd like to think the cases have plateaued because people have figured out how to keep themselves safe. But, you know, we hope that's the case.
Sure.
All right, that's all I had. Thank you.
Mm-hmm.
Thank you, Tori. Now we have Olga Guerrero with El Editor.
Buenas tardes, and I just love to see y'all's faces just smile when Lacey says, and now we have Olga Agüero. I think that's awesome. But good day to everybody. I'm glad that Lubbock was designated as a vaccine for the hub. I think that's great. That's more pleasant news for Lubbock. We need to try to encourage the people who needs to be encouraged to get us more vaccines if all possible. So maybe we can consider having drive-by vaccines. People have called us and say, why aren't we having drive-by? So that's something to just for y'all's consideration. A little bit more educational would be helpful from the doctors coming out as people are concerned. Do they mix the second vaccine? If you had Moderna first, and then can you have the Pfizer next? I think that's an important educational PR that needs to be thrown out there. And there's also talk about doses getting cut in half. I think that's something that needs to be put out there, and hopefully it's no, but it's up to y'all. And then I'll tie in my second question. That way I won't take too much of your time. That's also for the doctors. Linger side effects. Will they be eliminated when both vaccines are given? There's people saying that there's different kinds of side effects, hard breathing, when they do a little bit more than what they do every day, rashes in their backs or in their legs. And will all these linger side effects leave once both vaccines are being taken? And thank you for your times and efforts, and we love you.
Thanks, Olga. Let me help start off that PR campaign about the vaccine. No, if you receive Moderna, you must get the second dose of Moderna. We don't mix doses. So if you get Pfizer, you need to get the Pfizer as the second dose. If you get Moderna, you get Moderna as the second dose. And at this time, there was some talk in the literature and on social media and the news talking about to make the vaccine go further, should we cut the dose in half because its immune response might be close to the same? That hasn't, there was talk about that, but as far as I know, Olga, nobody is doing cutting the dose in half. And so it looks like we have plenty of vaccine coming in. And so that's important news. And I think with some of the newer vaccines that are coming online soon, I think we're going to have plenty of vaccine within a few months. And then your second question, if I understood you correctly, if getting the vaccine, does it make if you've had COVID and then you get the vaccine, does it make those long-lasting effects go away? Is that your question, Olga?
Yes, sir.
Okay. We don't know. Maybe. We're still trying to build up the whole purpose. So when you get infected with COVID, you build up an immunity. That's why we say most people at 90 days, if we're running short on vaccine, you could wait at least 90 days before you sign up to get the dose of vaccine. But both, whether you have COVID or whether or not you get the vaccine, you build up an immunity to the virus. I can't guarantee you that your lingering side effects, if you had the cough and the headaches and the muscle pain and these joint pains that kind of run around from different joint to joint, that's still part of the inflammatory process of getting the disease. And I don't know that getting the vaccine would make those inflammatory processes get any better. So the goal there is not to get COVID. And we get COVID by wearing a mask, social distancing, those sorts of things, and getting the vaccine.
Thank you.
Mm-hmm.
Thank you, Olga. Now we have Karen McKay with KCBD.
Hello, everybody. Dr. Cook, you said earlier, pay attention to that date for the second dose. And Mayor Pope, you also said your second dose is secure, and that all sounds great. But since we know there is little notice on when and how much vaccine will arrive, how do people know if that second dose will actually be there on their date of return? And is there a plan in place to let people know if it's not?
Well, let's let Catherine. Catherine talked a bit about that a minute ago. Let's let her start on this, please.
And part of receiving those first doses from the state is a guarantee that an equivalent amount will be shipped to us 4 weeks later. So we don't have to wait to see what that allocation is. We will automatically receive that second dose because we already received the first dose.
Okay. Another question then. What if you're feeling symptoms between doses? And of course, since this is also flu season, I mean, whatever it could be, should people wait, or how do they handle that if they are feeling something between doses?
Well, Karen, I think we would treat that as any new disease. It could be flu. The good news that our flu, last year about this time, about 20% of our patients had flu. This year it's about 3%. And so our flu, whether is it just going to be a late blooming flu, or is our flu so low because we're doing our social distancing, facial covering, hand washing, those sorts of things? I think it's probably the latter, not the prior. So that's good news. But I have known of a few people who got their first dose of vaccine and then subsequently became infected, not related to the vaccine, but were exposed and came down with COVID because they had an exposure. It was not related. This vaccine cannot give you COVID. I want to make that clear. This vaccine cannot give you COVID. So if you come down with COVID in between the two, it's because you were exposed. And so, and then as you recover, you would certainly need to get your second dose too, just to complete the vaccination series.
But you should wait. Is that what you're saying?
No, I wouldn't. I would go ahead and get it scheduled. I mean, if you're at home sick in bed with COVID or in the hospital, we're not going to give you your second dose then. So the recommendation for the second dose is either recommended is the same time at 3 weeks or 4 weeks, depending on which Moderna or Pfizer or Moderna that you received. You should not get it any sooner than 4 days prior to that date. But the second dose can be on that date or sometime afterwards. So if you got sick and you were hospitalized, or you have something happen and you missed it by a week or two, we'd still give you your second dose.
Got it. It'd still be effective, right, Doc?
Absolutely. Absolutely.
Yeah, okay. That's the key point, I think.
All right, thank you.
Thanks, Karen.
Thank you, Karen. Now we have Amy Kazera with KMAG.
Hi, everyone. Thank you so much for the opportunity today. My question today is about some of our folks that might be homebound. So for those that are homebound, how are you making sure that they, if they're eligible for the vaccine and they're not at a long-term care facility already, how are you ensuring that they are getting the vaccine?
Catherine?
Yeah, this is just like Mayor Pope mentioned, that there are gaps with some of individuals living in, senior living. We also have some gaps with those in, that are homebound. And we are going to have to work on ways to vaccinate those individuals. And a lot of those receive home health. So a lot of it's going to be partnering with those home health agencies to help us go into those homes and administer the vaccines.
Okay. And then for some folks that were to show up at the Civic Center, say they didn't have an appointment, but they might be 60, they're close to being eligible in that 65 category. Would they, if they were just to show up at the Civic Center and ask for a vaccine, what would the process be for that?
Anybody receiving vaccine through the city of Lubbock and at other physicians' offices throughout the community need to meet either the 1A or the 1B category. We have to adhere to those governor's requirements. So if they're under 65, they have to have one of those listed health conditions that would allow them to be vaccinated. We have very limited walk-up. We cannot guarantee vaccine. However, if there is a gap in the line, or at the end of the day, if we have additional doses, we will try to accommodate those individuals. The best way to ensure that you're going to get a vaccine at the clinic is to have an appointment. Those people with appointments, I have vaccine reserved for them, and they will get vaccinated that day.
All right, thank you.
Thank you, Amy. Now we have Terry Furman with KLBK.
Good morning, everyone, or good afternoon now. I'm going to start with a question. We've had several people ask this, and I just want to make sure it's clear for them. When they come to the Civic Center, if they cannot get out of the car, are we taking the shots to them?
Yes.
Okay. So is there anything special that they need to do, Catherine, to ensure that people know that they're there or that they're ready for their vaccine?
So anybody that is unable to walk through the Civic Center, we are able to accommodate them with a very small drive-through clinic. We're keeping this small because it's much safer for us to give the vaccine to individuals outside of the car. So we really want those who can walk to come into the Civic Center. We are doing a small drive-through through the Civic Center garage. And those people that need that accommodation, call the health department to either make that appointment, or if they made it to a select a seat, contact us. We'll give them direction and we will notate on their appointment time that they need the drive-through option.
Perfect. Now, my next question is this. Talk a little bit about what the next phase would be and who would be included in the next phase when it opens up, and how long do you think it's going to take us to get to the next phase?
Go ahead, Catherine.
Oh, okay. I wish I had an answer for that.
Did you see Dr. Cook and I sort of throw that hot potato your way on that one? It's like,
There is.
We've been so focused on 1A and 1B and making sure, and then there's talk about anybody that's over 65, just opening it up period without comorbidity, in our lack of vaccine until recently. We still have thousands of 1A, 1B people to get through. I apologize for not knowing that just right off the top of my head. I've looked at that phase table a number of times. And so those people would be, phase 3 would be students and other very low risk individuals. So anybody that's not included in phase 1A and 1B would be in phase 2.
Of course, I know that's hard to, determine, but thank you.
Thanks, Chair.
Hey, Terry. Now you have Christy Martinez Garcia with Latino Lubbock.
Olga, ditto. They smile when I come on too. Just kidding. Listen, thank you for being here, and thank you for having Ms. Trejo and Vernita, two individuals very highly respected in our community. I wanted to, in response to an earlier question, provide some important statistics. First, Hispanics nationwide who contract the coronavirus are hospitalized at 4.1 times the rate of other populations. They also make up 24% of workers in the hospitality industry, which we know was hit hard during coronavirus-related shutdowns. Hispanic residents with COVID-19 are more likely to say they have essential jobs and have kept working while sick. They also have disproportionately experienced COVID-19 deaths over others, including in Lubbock. Some of the city's biggest struggles for the city to connect with this specific audience or audience of colors include cultural incompetency, the lack of representation of staff in significant roles. We even saw that as the camera was tossed back to Maggie, the lack of translated marketing materials. And this has been pointed out many times. I even asked last week if the city is keeping record of ethnicity in testing, and the response was no, but rather that the crowd looked diverse. And the response to maintaining the testing demographics was that the tracers are not asking, do you guys understand the significance of keeping such data, whether it is testing or vaccine, and that your focus should not be national failures, but what can be done locally to learn from these examples and properly record that data? That being said, will you do more as we move forward?
I think the answer is yes. I don't know. I'm not sure. The answer is yes. We'll continue to do more. I'm not sure what the first part of that was. It sounded more like an editorial, but we will do more. We are trying, even as we speak, to find a way to gather data on those that we are vaccinating. But we're most importantly trying to get the vaccine in arms, and the sign up process. That's another step that complicates it. We're working on that as we speak. I'll wait for your second question.
Well, Mayor, I appreciate your response, but it has definitely been issues that we brought up since the beginning. But let me go on to my next question.
Thank you. Thanks, Christy.
Yeah. Dr. Cook, you mentioned many new vaccines, and it was announced Monday that trials have begun in London for the next generation of COVID-19 vaccines, which the first dose of a new nasal vaccine being developed by a US company called Codagenics, which is a single dose. In your experience, do you believe people prefer nasal vaccines to needles? And do you think that might be an opportunity to get more people to get the vaccine when the opportunity arises?
Well, so most of my experience with any kind of nasal vaccine was with the flu vaccine that we had in children. And I suppose, and it was, I think, an attenuated virus. And so it had a pretty good response rate. I think it was the preferred choice for children, but who wouldn't rather get a squirt in the nose than a shot in the arm? So I think we'll just have to wait and see what their outcomes are, what their immunity efficacy shows up after when their studies come out.
Thanks. Have a great day, everybody.
Thanks, Christy.
Thank you, Christy. Lastly, we have JJ Baca with the Daily Toreador. Okay, I'm going to have to promote you, JJ, because you have a different version of Zoom.
So while we do that, let me answer Terry's question. Phase 2 includes teachers in schools, staff, childcare workers, supply chain workers, but we're already doing some of those because the state of Texas wants those people are more important. That's not a good word, are certainly at risk for transmission and getting the disease. So we're already doing some of those. It depends on which definition of phase 2, Terry.
Okay, Javier, I'm going to unmute you.
Hello, I just wanted to ask about the new variant, if just to have some verification that will the vaccine still be effective against this new variant?
JJ, everything that we've seen thus far says that our current vaccines are covering that. So it's just that it can spread faster and overwhelm a hospital system. That's what we're seeing in the UK because it just spreads faster, gets more people sick, thus more people are going to go to the hospital. But our current vaccine does cover it.
Okay, that's all I had. Thank you.
Okay, thank you, JJ. This concludes our news conference for this week. Remember, we have all the latest information on the city's COVID-19 vaccination clinics at mylubbock.info/COVID-19 vaccine. We'll see you next